is also. So when you just look at the cerebellum, so where is the cerebellum present? It is present behind the brainstem. That means it is present behind midbrain, pons and medulla. These three together we use the word brainstem. So on posterior aspect of the brainstem we have cerebellum. If you just take a section at this point, whatever area is there above, you call it as superior surface, and whatever area is there below this line, you call this surface as inferior surface. So two surfaces we have, one is superior surface and the other is inferior surface. Here you are shown the same thing actually, like if you just observe, like one surface you are seeing, this is the superior surface and this is the inferior surface. Throughout the superior and inferior surface there will be one midline structure which is called as vermis. Okay, on the superior surface we have two lobes. What are those? One is the anterior lobe and the next we have is posterior lobe. Between anterior and posterior lobe there is a fissure which is called as primary fissure. Primary fissure. Okay, now this is superior view, I said, when you see from above. When you see from below, so what are the other structures we see? This was anterior lobe, this was middle lobe. The same middle lobe is continuing here. Okay, that means whatever lobe which is left over, that is posterior lobe. So how many lobes we have? Anterior lobe, then we have middle lobe, and more behind you call it as posterior lobe. That's why posterior lobe is given in brackets. This is the posterior lobe. Okay, now if you observe, there is one more lobe here which is called as flocculonodular lobe. We have done cerebellum in physiology also. There I have given you the three subdivisions, if you remember. What are those? Spinocerebellum, isn't it? Vestibulocerebellum, archicerebellum. So that type of subdivision also you can write here in anatomy, but some of the details you have to write from anatomical aspects also. Now when you just talk about this central part, what is the name of this central part? It is called as vermis. So vermis will have certain subdivisions. Are you finding there are certain horizontal lines? These horizontal lines will divide the vermis into 9 parts. Okay, so these 9 parts will have correspondingly the other divisions also. For this I will give you one code. You can make a note: LCCD, LCD TV, like that, but C has come double. LCCD FTPUN. FTPUN is the code for you to remember. First we have lingula. So this is the lingula. Corresponding to the lingula, we do not have any subdivision of cerebellar hemisphere. Second subdivision of vermis is central lobule. See, this is the central lobule area of vermis. Corresponding to central lobule, we have ala. Okay, then next subdivision of vermis is culmen. Corresponding to the culmen, we have quadrangular lobule. It is written here. This is quadrangular lobule. Okay, LCCD. D is declive. Along with declive, we have simplex lobule, or see here, simple lobule. Then next we have folium. So along with folium, we have superior semilunar lobule. Continuation of this is superior semilunar lobule. After FT we have, isn't it, FT? FT, that is tuber. Tuber is in continuation with inferior semilunar lobule. Tuber, inferior semilunar lobule. Okay, then pyramid. Pyramid is in, this area is pyramid beta. So pyramid is in continuation with biventral lobule. Biventral lobule. Okay, then uvula. Uvula is in continuation with tonsil. Okay, uvula is in continuation with tonsil, and then last we have this nodule. This is the primitive part of cerebellum which is present even in lower animals, which is in continuation with flocculus. So archicerebellum, paleocerebellum, neocerebellum, these subdivisions we have studied in physiology also, and either you read it from an anatomy or physiology. Already if you have read from there, you can write the same information. We will give you marks. There is nothing to worry at all. Okay, so these are the parts of vermis. Correspondingly, these are the subdivisions of cerebellar hemisphere. Please practice this table without fail, And please practice this diagram without fail. For your final exam, if cerebellum is coming as an essay, you are supposed to know these parts thoroughly. Okay, so cerebellum is the largest part of hindbrain. Cerebellum consists of two cerebellar hemispheres, that means right and left cerebellar hemisphere. This is one hemisphere, this is one hemisphere. In between two hemisphere, what is this earthworm-like connection? Vermis. I told you it has two surfaces, isn't it? If you view from above, you call it a superior surface. If you view from below, it is called as inferior surface. So it has superior and inferior surface, and two hemispheres are continuous with each other on superior surface. Inferior surface is showing one deep median notch called as vallicula. Okay. So what is the name of the ventricle which is present between the brainstem and cerebellum? What is the name of this ventricle? Niharika, we already studied this ventricle. Kirti, Pavan, fourth ventricle.
Fourth.
You see here, fourth ventricle. Parts of the cerebellum, I said we have horizontal primary and posterolateral fissure. We have like three lobes, no? The anterior lobe, middle lobe, and the inferior lobe. Okay, these are the subdivisions. Then this is not required, beta, you need not worry. So this is vestibulospino and neocerebellum. You have already done in physiology. In case if you have not studied in physiology, here also tracts are given. Like in vestibulocerebellum, the afferent tracts, that means the tracts coming to cerebellum from different parts. We have vestibulocerebellar tract efferents are cerebellovestibular and fastigiobulbar. The functions of vestibulocerebellum, it fixes the position of body during skill movements. What I sincerely suggest you is do this functional division of cerebellum from physiology. In anatomy, it won't be asked more. And physiology people will more deal with functional components. Better you do functional part from physiology. If not, if you find this table easy, you can learn this table also. Okay, just now the question was cerebellar peduncles. So what are peduncles? See here, this is brainstem and this is cerebellum. The brainstem will have to and fro connections with the cerebellum. So these to and fro connections with the cerebellum are nothing but cerebellar peduncles. For example, this is midbrain. From midbrain, we have afferent connections and also we have efferent connections. This makes superior cerebellar peduncle. Connection between midbrain and cerebellum is superior cerebellar peduncle. Connection between pons and cerebellum is middle cerebellar peduncle. Connection between medulla oblongata and cerebellum is inferior cerebellar peduncle. So both the three, like all the three peduncles will have afferents and efferents. Okay. So that is now your question he has asked us. Like what are the three peduncles? We have cerebellar peduncles. So in both the things we have afferents which are coming from different parts and coming to the cerebellum. So superior cerebellar peduncle, the afferent tracts are anterior spinocerebellar, tectocerebellar. Efferents are, they start from cerebellum. In the cerebellum we have four nuclei also, no Niharika? What are the four nuclei? I told you there is one code also to remember, DEFG. Nuclei of cerebellum: dentate nucleus, emboliform nucleus, fastigious
Passive
nucleus, lobosus
nucleus.
nucleus, isn't it? These are the collection of gray matter within the white matter of cerebellum. Like we have basal ganglia for cerebrum. Similarly, these are the nuclei we see in the white matter of cerebellum. Okay. So here you will get few words like dentatothalamic. That means from the dentate nucleus of cerebellum to the thalamus, the tract is going. Dentato-olivary. Dentate nucleus to the olivary nucleus of medulla oblongata. Fastigious nucleus to the reticular formation of brainstem. In the name itself, you will have meaning. You can elaborate so much. Tectum is the part of midbrain. Tectum to the cerebellum is the afferent tract. Spinal cord to the cerebellum is spinocerebellar. Pons to the cerebellum is pontocerebellar. Like that, you have many tracts: cerebello, vestibular, olivary, and reticular. That means we have all these tracts which are found in superior, middle, and inferior cerebellar peduncle. So first two are small and easy. For The last one, 9 connections are there. No, I will give you one code, you can make a note. Pop CV star, pop pop, CV, C and V, star. See here, STAR, star is the code for you to remember the things easily. You can write here in your textbook, pop CV star. Okay, P standing for afferent tracts like posterior spinocerebellar, olivocerebellar, paraolivocerebellar, cuniocerebellar, vestibulocerebellar, striamedullars, trigeminocerebellar, then anterior external arcuate fibers, reticulocerebellar. Like based on the code, it becomes easy for you to recollect the things. Okay, so these are the peduncles which draw this picture also. Like if you give labelings or not is many labelings, at least minimum labelings you can give, because already you have learned the table there. Once you start learning, you will memorize those tables, right? So connections of cerebellum, this is for peduncles. Draw this for peduncles. Rough diagram you can draw. Artistic diagrams nobody will expect. Concept oriented diagrams are enough. Okay, so these are the tracts we have in cerebellar peduncles, and these are the nuclei. DEFG is the code. This is the posterior aspect of the brain stem, which is nothing but floor of the fourth ventricle, isn't it? Position of cerebellar peduncles. Here, these are the three peduncles we have: superior, middle, and inferior cerebellar peduncles. Peduncles are cut. Cerebellum is removed. So once you are removing cerebellum, you are seeing this area, this one, where I am scrolling my arrow now. That is nothing but the posterior aspect of pons and posterior aspect of medulla. You removed cerebellum, hence you are seeing the floor of the fourth ventricle. That picture is actually the floor of fourth ventricle, which we have already discussed. This labeling you have to practice for the floor of fourth ventricle. Stria medullaris is the partition. Upper half is pons, lower half is medulla. Whatever labelings are there, you need to list out for the floor of fourth ventricle. Okay. So next essay is tonsil. So till I take you to the next essay, functions better you read from physiology only better. There are many functions we read. Here only few are there. Like it is controlling the same side of the body. It controls the voluntary movements. Okay, it controls stone posture equilibrium. Controls the movements of eyeball. Okay, it controls the axial muscles. So cerebellar dysfunction, that means if the cerebellum is not working, the manner of walking is disturbed, that is ataxia. Labyrinthine is present in basically in the middle internal ear. We have semicircular canals. We have connections of these semicircular canals with the cerebellum. So suppose if cerebellum is damaged, person will have always like chakkar reeling type of sensation. Okay, so that is labyrinthine connections are lost, because of which they will have those lesions. Okay, speech is also defective. So that is all about cerebellum. I will take you to tonsil. Meanwhile, keep reading cerebellum. So what are the 12 pairs of cranial nerves we have? First one is olfactory, second optic, third oculomotor. Now we are going to discuss the details of oculomotor. So first thing is, first of all, you should know from which part of the brain stem it is arising. So this is the floor of the brain. So you are finding this is the like orbital part of the inferior surface, and this is tentorial part. This is our cerebellum, and you are finding this area we will have midbrain, which is hidden. This is pons. This is medulla oblongata. Okay. Now from the anterior, this is our anterior border of pons. If you remember, we have discussed interpeduncular fossa also. This is the anterior border of pons. From the anterior border of pons, if you observe, there is one cranial nerve coming. What is the name of this nerve? Oculomotor nerve. Okay. So, oculomotor, that is from the anterior border of pons. I told you that is very close to midbrain. Midbrain is hidden here. You cannot see. Okay. Now, let us see this third cranial nerve. Its functional components are here. Optic nerve, optic chiasma, optic tract, we did, isn't it? So first, this course and all, unless diagram is there, you cannot understand. First, I'll try to make you understand with diagram, then I will take you to theoretical aspects. So first, what did I show you? Base of the brain I have shown you, and I have told you like midbrain is hidden, like right in front of pons, you are finding the nerve is coming out. To be more specific, basically this is the cut section of midbrain. So in this cut section of midbrain, you are finding these are the cerebral peduncles. Okay, and this is the central canal, like cerebral aqueduct of Sylvius. So this is actually like you have nuclear complex of third cranial nerve, third nerve nuclear complex. So from the right side you are finding right oculomotor nerve is coming, from the left side you are finding the left oculomotor nerve is coming. So the point of origin of this oculomotor nerve is midbrain. So if you remember me telling you superior orbital fissure, when I was discussing orbit, I told you superior orbital fissure, and I have already discussed cavernous sinus, isn't it? When we were discussing cavernous sinus, I told you the lateral relations of cavernous sinus also. So laterally, the cavernous sinus is related to many nerves. Now because we are dealing with third cranial nerve, so oculomotor nerve is also related to this cavernous sinus laterally. Now let us see complete course. You will easily understand and write everything if you practice this picture. It's very easy, beta. Now this is cut section of midbrain. So from in the midpoint of the cut section of midbrain, we have that central canal like we have for spinal cord. No, I'm using that word to make you understand. Here it is called as aqueduct of Sylvius. Okay, below which you are finding these are the nuclei for oculomotor nerve. Nucleus for oculomotor nerve. Now our third cranial nerve has come out successfully from midbrain. Okay, it is passing between two blood vessels which we see in the brain. What are these two blood vessels? Superior cerebellar artery, and we are also finding posterior cerebral artery. It is running between these two blood vessels. Now, in the middle cranial fossa, do we have cavernous sinus? Yes, it is there. Cavernous sinus is there. It is traversing lateral to the cavernous sinus. What is this opening we find behind the orbit in the anterior cranial fossa? What is the name of this fissure? Superior orbital fissure. So that means from midbrain, it is crossing these blood vessels, it is crossing the cavernous sinus to enter into superior orbital fissure. Once it enters superior orbital fissure, it will enter into orbit. We have studied orbit, we have studied extraocular muscles. I'm always asking you to screen record my lectures also simultaneously so that you can revise. Okay, so extraocular muscles, whatever we have studied, what were those? Superior rectus, inferior rectus, medial rectus, lateral rectus, superior oblique, inferior oblique we have studied. And I told you, except SO4 and LR6, that means superior oblique is by trochlear, lateral rectus is by abducent. Rest of all muscles, rest of all extraocular muscles are supplied by which nerve? They are
Oculomotor.
very good. Oculomotor.
Okay.
Nice, very good. So now see here. So this same oculomotor nerve, once it is passing through superior orbital fissure, it has successfully entered into orbit. Orbit. These are our orbits where we have eyeball, and muscles are not seen. They are just above the conjunctiva, which are not visible, but controlling our eyeball movements, isn't it? So once it is entering into superior orbital fissure, you can see it is dividing into two divisions. What are those? The division which is above, you call this as upper division, paiki veltundi. And the division which is below is lower division. Lower division is larger, LL you remember, and the upper division is smaller. Now let us follow the upper division. The upper division is supplying which muscles? If you learn this
Right.
diagram, write complete answer in your own words. What are the muscles supplied, beta? Levator, palpebrae superioris and superior rectus. Now just follow the course of lower larger division, beta. It is supplying medial rectus, it is supplying inferior rectus, isn't it? And one twig is also going to the like ciliary ganglion. Not lateral rectus. Lateral rectus is by abducent. Ciliary ganglion. Okay, learn this diagram and write in your own words. Now let us see the theoretical aspects. Now you will understand because now you have learned oculomotor. Some story you have understood. Okay, functional components. Basically, you will understand functional components if you see in the floor of fourth ventricle. Basically, we have many cranial nerve nuclei. I'll show you those nuclei. So this is the common table which helps you understand everything. See, this is midbrain, pons, medulla, floor of fourth ventricle we saw, no? So at that point, we have certain special nuclei. Okay, so like for trigeminal nerve, we have nucleus. Now, this is our midbrain, no? At this level only our oculomotor nerve is coming. So what is the name of the nucleus here? This is the oculomotor nerve nucleus. Very close to this, we also have Edinger-Westphal nucleus. Trochlear is fourth nucleus. So in the midbrain, they are in order only, but a third, fourth, fifth, sixth, like that it will be in order. It's not so difficult also. In fact, oculomotor nerve nucleus is situated at the level of midbrain, that is at the level of superior colliculus. We have discussed corpora quadrigemina. I told you superior colliculus, inferior colliculus, four elevations we have at the level of midbrain, posterior aspect. So this nucleus is at the level of superior colliculus. So you have, these are the functional components: general somatic efferent, general visceral efferent, general somatic afferent. So somatic efferent is for the movements of eyeball. Efferent is always motor, beta. Motor. General visceral. This is going to pupil. It helps in accommodation of pupil. Accommodation, pupillary reflexes we studied in physiology, and their oculomotor nerve also was coming. Contraction of pupil. General somatic afferent. This is for position sense. Okay, these are the functional components of this nucleus, what you have just seen. అంటే ఈ న్యూక్లియస్లో ఎన్ని ఫంక్షనల్ కాంపోనెంట్స్ ఉంటాయి, వీటిని కంట్రోల్ చేస్తాయి. మూమెంట్స్ ఆఫ్ ఐబాల్, కాంట్రాక్షన్ ఆఫ్ ప్యూపిల్, అకామిడేషన్ అండ్ proprioception. So this is the basic information like which you basically understand from the theory points if you have. But see, third cranial nerve, it is applied to the extraocular, whereas and also intraocular. The general somatic, visceral, somatic afferent components. Nucleus is the oculomotor nerve nucleus, which is situated in midbrain. To be more specific, ventromedial part of central gray matter. If it is so difficult, write midbrain at the level of superior colliculus. That is also fine. Niharika, are you understanding?
Yes, ma'am.
Course ఇందాక మనం చదివింది, it is at the base of the brain, it is attached to the medial side of the crus cerebri. That is nothing but midbrain only. But oculomotor sulcus, that area where nerve is coming, medial side of midbrain. Specific word we have crus cerebri. Nerve is passing forwards, interpeduncular fossa area to reach cavernous sinus. It enters cavernous sinus. It goes laterally to the cavernous sinus, where it is dividing into upper and lower divisions. Two divisions enter the orbit, passing through superior orbital fissure. middle part of superior orbital fissure. And we know like the smaller upper division is giving those parts, larger lower. ఆ diagram చూసి మొత్తం రాసేయచ్చు. Okay, once you know the basic anatomy of this oculomotor nerve, now we will try to learn the clinical aspects. Now question also will be framed like this only, but a patient has come with drooping of upper eyelid. Drooping means ptosis, and patient has